In 2019, news that 2 prominent female K-pop stars had reportedly taken their own lives left their fans heartbroken. 28-year-old Kuhara was found dead in her home after being subjected to abusive online comments. Not long before she died, she was caught up in a legal drama over a sex tape allegedly filmed by a former boyfriend. 6 weeks earlier, another singer, 25-year-old Sarli, who also reportedly had a long struggle with online bullying, took her own life. Their deaths were shocking enough in 2019. But in 2020, there is evidence that young South Korean women are turning to suicide in ever greater numbers. South Korean National Police data indicates that 296 women in their 20s killed themselves between January and June. That's a rise of more than 40% compared with the same period the previous year. The problem has become so acute that the South Korean government has classified women in their 20s and 30s as an official risk group for suicides. So what's behind these alarming statistics? The South Korean economy has plunged into recession because of the Covid-19 pandemic. Many businesses have had to lay off staff or have been forced to close altogether. And this has affected women in a big way. From February to April, 617,000 women lost their jobs, compared with 401,000 men, according to a government think tank called the Korean Women's Development Institute. Most of the women who lost their jobs worked in the hotel or food service sectors, which have been hardest hit by the pandemic. KWDI has written about how female workers in their 20s are at high risk for dismissal because of their lack of experience and because they're often assigned tasks that are considered less important. There's a huge sense of relative deprivation that comes with the inability to make an impactful contribution to society, wrote KWDI researcher Kim Young-taek. The Institute's report says many women in their 20s also faced gender discrimination in hiring and dismissals during the pandemic. A large number of young females are not covered by employment insurance, so they don't have access to government subsidies that officially registered workers can get. It's not just because our country has the largest gender wage disparity among the Organization for Economic Cooperation and Development countries, wrote KWDI researcher Kim Nan-jue. But it's also the fact that the overwhelming majority of part-time and low-quality work is given to women, while ultimately women are given far fewer hours to work even if they want to do more. But the problems South Korean women face stretch back much further than the pandemic. South Korea has long struggled with suicide rates that are twice the OECD average. The country's Prime Minister, Chung Se-kyun, told policymakers in November, "It is hard to tell what effect COVID-19 will eventually have on a country that already has one of the highest suicide rates in the world." He also noted the suicide rate had been creeping up for decades, with similar spikes after the 1997 to 1998 Asian foreign exchange crisis and a domestic financial crisis in 2003. Researchers at the KWDI say since 2008, women were far more likely than men to experience health problems as they generally suffer from a lack of money and social resources. Another issue could be sexual harassment. Nearly 1 in 4 women who reported being harassed or secretly filmed said they considered suicide, according to a 2019 survey of 2,000 victims by the KWDI. There have been several high-profile incidents of sexual harassment in South Korea in recent years. This includes the so-called Nth Room case, in which an online network blackmailed women into sharing sexual videos. At least 74 people, including 16 underage girls, were abused. The KWDI has reported that victims who faced threats of circulation of video they were in, or who had their images posted online, displays high rates of self-injury and suicide attempts. The South Korean government has taken steps to address the rising suicide rate among women. Officials have committed to strengthening counseling services, and the understaffed National Suicide Hotline has been recruiting more members. They've also promised to increase benefits for young women taking unpaid leave or those looking for freelance or internship opportunities. Authorities have vowed zero tolerance and tougher punishment for digital sex crimes. But South Korea must still tackle factors in society that have given rise to one of the highest suicide rates among developed nations. If you're having suicidal thoughts or you know someone who is, help is available. In Hong Kong, dial +852 2896 0000 for the Samaritans, or +852 2382 0000 for suicide prevention services. In South Korea, call the National Mental Health Crisis Counseling Hotline at +82 064 1577 0199 or 129 in the country. For a list of other nations' helplines, visit this website.